Hey there, my name's Alexis. I'm going to be your student nurse today. I'm going to go ahead and perform hand hygiene and give us some privacy. So can you tell me your name and date of birth? Okay, awesome. And do you happen to have any allergies to betadine, shellfish, or iodine? Okay, awesome. So today I'm going to be inserting a Foley catheter, and this is just a tube that is inserted into your bladder to relieve you of urine. And how we'll go ahead and start this is I'm going to have you position your legs up into the froggy position, which is lithotomy. So I would move my patient's legs into this position, and I would let them know that I'm going to be exposing them. So I would expose my patient, and then I'm going to proceed with moving on to my sterile field. So for this portion, I'm going to go ahead and open away from me. So I'll pull and open here on my 1-inch border, and then I'm going to pull this one away from me as well, and then this one away, and then this one away. So I'm just going to, by reaching my 1-inch border, I'm going to pull this into a good position, and I'm going to set this aside, and then I'm going to go ahead and drape my patient. So I'm just going to slide this here, and by using my 1-inch border, I'm going to go ahead and open my drape and lay the shiny side down under my patient. Now I'm going to be taking my sterile gloves and placing those on the side, and then I'm going to be opening them like this. I'm going to be doing my my dominant hand first, and I'm just going to be touching in here. Okay, and I'm going to go ahead and place this other one on. Now that I have these gloves on, I'm going to go ahead and remove these non-sterile gloves. I'm going to go ahead and move my box and place those aside. I'm going to take my alcohol swabs, and I'm going to go ahead and move my box to the side, and then I'm going to place my alcohol swabs in this bottom tray, just here on the side. I'm going to remove my specimen cup and place this over here, and then I'm going to take my lubrication, put this in the corner of my box, and then I'm going to go ahead and pull my catheter out of its cover, and I'm going to be doing this while wrapping it around my finger to make sure that I stay within my sterile field. Just going to continue to wrap this around my finger until I'm at the tip, and then I'm going to place this tip in my lubrication Okay. And now I'm going to go ahead and take my water and do this and place this in my line for whenever I'm ready. So now I have completed all of this. I'm going to move over to my patient. So I'm going to take this box and position it here between my patient's legs. I'm now going to go ahead and swab. So I would, going down the labia, I would swab the side closest to me first, and then I would swab the farthest away from me. So I would swab there and then throw that out. And then I would swab all the way down the middle and throw that out. Now I'm going to go ahead and spread my patient's labia, and since this has touched the patient, this would be a non-sterile hand at this point. So now I'm just going to continue to hold the labia open and look for my urethra. And then I'm going to take my catheter head, which is in my lubrication, and I would tell my patient to go ahead and bear down and take a deep breath for me. So now I'm going to insert the catheter in. Insert my catheter in my patient. And I'm going to push until I feel like I'm at a good point. And that's going to be about 2 to 3 centimeters. Obviously, I'm having some difficulties because this is not a real patient and it's moving. But I would keep that in position, and then I would go ahead and advance my liquid into my patient. So I do about 5 centimeters of that. Sorry, 5 millimeters of that. And then I'm going to go ahead and do my pull and tug method. So it's nice and tight, so I'm going to go ahead and just push that in a little bit. And now that it is in position, I'm going to remove, oh, I just broke sterile field. Okay, I would take this off and then go ahead and, okay. All right, so I'm breaking a lot of sterile field. I'm gonna go ahead and put this back in position. And then after I've advanced the liquid, I'm gonna take my gloves off and do hand hygiene and then put on non-sterile gloves. Then I'm gonna remove this out, and I would make sure, okay, well, my tubing fell off obviously, but I'm gonna make sure that I connect this on a stat lock on the patient's leg and make sure that there's enough that's kind of where there's good tug. And then I'm gonna take this bag and place it on a non-moving part of the bed and just place that down at the bottom. Now to remove it, I would go ahead, I'm gonna place this back in here because it keeps falling out. I would go ahead and don sterile gloves, and then I would take my liquid and go ahead and attach this, and gonna perform perineum care, all of that, and then let my patient know that I'm gonna be removing this. So today I'm gonna be removing your catheter. I have monitored how much liquid you have expelled and gone ahead and documented that in your chart. So now if you will just take a deep breath in for me, I'm gonna go ahead and remove this liquid and pull this catheter out. So I would take this, pull all my liquid back in, and then hold here and tell the patient to take a deep breath and then remove the catheter for them. Now make sure to go ahead and perform perineum care after. That way there's no leftover betadine that sits on the patient or any type of urine that has expelled during the process of moving it out. So then I would go ahead and dispose of all my materials, wrap it up, and throw it in the trash, and then make documentation of what I found in my urine bag.